much as we want their cycles to be a success, there's always a group of people who tend to have a failed cycle. And patients must be aware that at least 1/3 of women who go for their IVF the first time, they will fail, or they can fail. So the most inevitable questions that patients normally ask is, could I have done something different to have made my cycles more successful, or could something else have been done to improve my IVF success rate? So I'll be talking about a few factors, mainly two actually, that plays a part in one's IVF success. The first thing is, obviously, is the mother's or the patient's embryo. Okay, to keep it very simple, let's assume that if you want to grow a plant, for example, you need to have a very good quality seed, and you need to have prepared fertile soil. So in an IVF, the good seed stems from the good quality embryo. So when we talk about a good quality embryo, what we essentially mean is that the number of chromosomes in that embryo is normal, and this is what we call as a genetically normal embryo, which is competent enough to sustain a pregnancy. What do we mean by a genetically normal embryo? It means that the number of chromosomes are normal. All of us have 46 chromosomes or 23 pairs of chromosomes. That is normal, and we define that as a euploid embryo. When an embryo has an extra number or a number which is less than 46, we call those as aneuploid embryos. So a good quality embryo is a euploid embryo, a bad quality embryo or a poor quality embryo is an aneuploid embryo. So when you talk about a euploid embryo, first things first, it stems most of the time when there's a problem in the embryo, it is from the egg. 80% of the time when the embryo is considered aneuploid or abnormal, it is from the egg. 20% of time is from the sperm. So saying that, for someone who has a very poor sperm count, of course, then for that couple, the contribution from the sperm is obviously more than 20%. But by and large, as far as we know from all research that has been done, an abnormal embryo usually stems from the egg. So saying that the most important factor that determines the quality of an egg is age of the woman. Most fertility centers or most fertility doctors will tell you that the longer you delay your pregnancy, as your age becomes more advanced, the chances of you having an abnormal or genetically abnormal or aneuploid embryo is on the increase. So what does that mean? That means that we all know that if you are 38 or 40 years and above, the chances of you succeeding in having a pregnancy is less. For the pregnancy to have an abnormal baby is obviously more. So to keep it simple, a woman at the age of 30, 1 in 2 of her embryos will be normal, as opposed to a person who's the age of 40, 1 in 6 is normal. At the age of 45, 1 in 20 eggs is normal. Okay, so again, the earlier you do your IVF, or the earlier you are that you start, the chances of you having a normal egg with a euploid number of chromosomes is obviously higher. So another misconception is, which I always hear most of the time, is that patients will say that, look, I've been told by the embryologist or the doctor that the embryos look great, they look very beautiful on the outside, but I still did not have a successful pregnancy. So why is that? Again, to keep it simple, a good looking embryo does not mean that the genetic number or the chromosome number in that particular embryo is basically normal. Okay? To quote an idiom, it's like saying beauty is skin deep. For an embryo, it's the same thing. Beauty is shell deep, or as you know, the egg has an outer shell, we call a zona. What's inside determines how good the quality of the embryo is, and that is what we call the chromosome. In order for us to know which embryo is genetically normal, there are certain genetics testing that is available now that we also do. It's called pre-implantation genetic screening, PGS, which will be able to tell us of the number of embryos that we have, which is genetically normal or not. And most of the time, this PGS is applied or is done on couples who have repeated IVF failures, or who the mother may be at an older age, because we want to pick the genetically normal embryos in them. The second, another important factor is, of course, the soil. In order to have a plant, you must have, as I said, a good quality seed in embryo, and also the soil. The soil in this circumstance means the lining of the endometrium, the lining of the uterus, must be receptive. I cannot emphasize this. It has to be receptive to receive the embryo that we are putting back in. If the uterus, the lining of the uterus, it is not prepared well enough, no matter how good the quality of the embryo is, it will not propagate into a pregnancy. So, what are the tests that we can do to ensure that the lining is satisfactory? There are a few things we can do before the cycle. What doctors will do, or most fertility specialists will do, is we will do a basic ultrasound to look at the lining. If we suspect that there may be an issue with the lining, we can also do an hysterosalpingogram to see how the lining appears. And also we can do what is called as a hysteroscopy, where we put a camera into the uterus to see whether the lining is regular, whether it is smooth, whether there's any polyps or anything like that that may affect the potential embryo to implant and to propagate. So these are the two most common factors that may lead to an unsuccessful IVF if we do not look into it carefully.